On behalf of the business community, thank you for taking the time with us today. With this outbreak and the current situation, we have a lot of questions about what employers should be doing to prevent community spread and to keep our workers safe and our businesses open. So Brian, we're gonna start with you. Could you please give us sort of an outline of our current situation and what is behind the recent spike in cases, and then also what has changed due to Governor Reynolds' proclamation last night at 6 p.m.
All right, well, first, I just want to say on behalf of the CG Public Health staff, the Board of Health, I want to say thanks for the opportunity to talk with the group here today. Not just our Mason City Chamber, our Clear Lake Chamber groups as well. I'm very pleased that I have this opportunity. You know, clearly these are times, they're simply unprecedented. And we recognize since March 8th, when we had Iowa's first case, that this has and continues to put a strain on our business community. And I got to say that from the start, I've felt support from the community as we try to respond as a public health partner. Our community response partners have been outstanding, and I could go on and on and on who all of those response partners are, but I do want to recognize them, and I also want to recognize that the continued strain that this has had on businesses, staff, and the community. We're going to work through this together. I continue to say that. We keep our heads up and try to move things forward. So to the question, what's going on in our current situation? I think everybody's pretty aware. As we visit with our Emergency Operations Center operations team, which is a lot of public health people, along with hospital staff and some community staff working with Steve O'Neill. Hospital cases are continuing to put a strain on our community, and that is the primary focus right now, is trying to limit the community spread so that we can better balance or handle the number of cases that are in the hospitals. But with that, we're also having quite a bit of conversation with our child care centers. As businesses understand very clearly that if parents don't have a place to drop their kids off for them to come to work, it creates a significant impact, which is why working with the schools is also a key point for us to continue to do, is try to work with the schools and keep schools open as best as we possibly can to provide, again, that continuity of community function, really. Our long-term care centers continue to increase in cases. We also communicate with them on a regular basis. Each of these locations, I mentioned hospitals, child care centers, of course, you as businesses, but our long-term care centers and our schools continue to have impacted staff that otherwise have to isolate and or quarantine. So it is, I'm not going to sugarcoat it right now. It is pretty dire. Our rolling 14-day average is 26.6%. And all but 5 counties, I looked at the statistics last night and this morning, all but 5 counties have greater than, or 15% or greater, all but 5 counties, we're talking 94 counties have rolling 14-day averages 15% or higher, which is really the trigger that we've been looking at for whether or not schools could consider a closure request or going to online learning options. I want to point out one other point that I caught this morning. There's some data that we monitor for how many days would it take to double the number of COVID cases. And so they've been tracking that. On October 25th, it would take 73 days for our COVID numbers to double, okay? That trend line has dropped significantly over the last 3 weeks. I looked at November 15th, so this would have been Sunday, we dropped from 73 days to double to 21 days. So we would go from 2,788 cases in 21 days. We could double that if we stay on that current trend. So that is a chilling number, especially when we think about where we're currently at statewide. I'm talking statewide related to our response and what's happening in the hospitals. So we then have to piggyback that with what is going on. We're working really hard to get flu vaccines out. I want to stress to all of our partners in the business community, if you have not, please stress for your staff to go get a flu shot. I don't care where you get it from. We're taking a small number of appointments here in the department, but go wherever you possibly can get it in the community, the pharmacies, the businesses, and the such. Go get your flu shot. The other thing I want to mention is, with our current situation, of course, we're getting some decent news, some good news about vaccine rollout, and I can talk about that briefly. We've been monitoring how vaccine is going to roll out. We have plans that are in place. We've been working with our businesses and our hospitals, our clinics, our long-term care centers about how that's going to work. It is most certain that no matter whether or not we're going to be using the Moderna vaccine or the Pfizer vaccine, the Moderna vaccine will be a little bit easier to manage because it only has to be frozen under normal conditions, whereas the Pfizer vaccine is going to have to be ultra cold frozen, which means it's either going to need to be placed on dry ice, which is a logistical issue for us to obtain dry ice. We've worked through that and we have a plan for that, but or we need to have a freezer that will hold ultra cold. We're talking negative 80 degrees Celsius. And so we don't have that capability here in the Department of Public Health, but community-wide, we should be able to have that availability. Nonetheless, it's going to require 2 doses, which does create some logistical issues for the department to make sure that when we're giving vaccinations, that people recognize that they're going to get a shot on day 1 and then have to come back on day 21 or day 28. And so, and I shouldn't say that's just the department. We're talking all of our locations that might otherwise be administering those doses. So at least the effectiveness rate that we're hearing from the CDC is very good. So we're talking 90% effective or 94.5% effective. So that is very good. Anything over 50% effectiveness rate is good. So the department continues to also consider our options for how we're going to distribute that vaccine in a very broad sense. When vaccines become available and we can give out thousands in a day, how can we get people through a single location and make that very useful and effective for people? We're looking at a drive-through site that could handle that kind of capacity. And so we continue to look at our plans for that. So when the term is brought up about pods, PODs or points of distribution, initially vaccine is going to be provided and we're going to be focusing on closed pods. So the hospital is considered a closed pod. Hospital staff will likely receive some of the initial doses, especially frontline staff in the emergency rooms, in the intensive care units, and probably on the COVID floors. In addition to that, long-term care centers will likely receive a direct shipment to provide vaccines to long-term care staff and residents. Obviously, those are the groups of people who are most endangered from getting COVID and then having complex or fatal repercussions from that. So that's a little bit about vaccine. I can answer additional questions if there are some, and that's generally basically where we're at. The numbers continue to escalate and the situation is not good.
Okay, so for the situation that we're in now and to try to keep it from getting worse, there's a lot of information about when you should quarantine, when you should isolate, so could you tell us what's considered close contact, and then what should an employer do if an employee tells them that they have had close contact with someone who is positive?
So let's first talk about what is close contact. So close contact is if you are around someone and both of you are not wearing masks, or if one person is wearing masks and another is not, that person is a positive case. You're around that person for for 15 minutes within 6 feet, that is considered a close contact. You're in close contact with a positive case, okay? So that's sometimes difficult to decipher. So let's say I have one of my family members is ill. I go home, I'm around that family member, I've been around a close contact. I then, if I've been around that contact within that 6 feet for 15 minutes, then I should quarantine myself for 14 days. Quarantine means you're going to remove yourself from being out in public, and you're going to isolate. You're going to observe yourself for any kind of symptoms. If you start to become symptomatic, it is then the idea that you would get tested to determine if you are a positive case. If you're a positive case, then you need to isolate for 10 days. And that 10 days is a general guideline. That means that you need to be no longer have a fever, where you can control that fever with fever reducing medication. You need to be improving, so your symptoms must be getting better, and it must be at least 10 days after you were first symptomatic. So again, I know those rules are a little bit cumbersome. We have that information on our website. If people have questions about that, we can help work through that. So what happens if an employee shows up at work and says, somebody in my family is positive and I'm now a close contact with that person? That person needs to be sent home immediately. They need to go home and they need to quarantine. And the expectation really, again, this is how we handle it here in our department, across the county, and all employers should handle this. The expectation is that employee is going to go home and isolate or quarantine themselves for that period of time. That doesn't mean that they get to go out into the public and, go get groceries or any of that stuff. No, they need to be home and they need to be quarantined away from other people. If you can isolate from someone in your family who might be positive, and let's say, so for example, one of my kids is positive, that I can isolate, that person can isolate away from me and keep their distance for that 615 rule. For that period of 10 days, you technically could call yourself not a close contact with that person. Now, if you have young kids, it's nearly impossible. So you're pretty much stuck. So those caveats and those situations, again, can be talked through with us. We're here to help consult with businesses to help. If there are some of those scenarios, by all means, give us a call. That's what we're here for.
So how about this scenario? There are so many people who are asymptomatic. So what if you have a situation where someone has had close contact, they are quarantining, they are asymptomatic? Should they get tested?
So that's a great question, Robin. And here's the thing that we've been saying all along, and that is, it's kind of a general rule of thumb. You cannot test out of quarantine. So when you are placed into quarantine, you're kind of stuck. I mean, you're stuck on the bench. And so where I try to keep this simple is, if somebody's been around a known positive case, that is the line in the sand. So that person must be tested and determined to be positive. If I'm around that person who's been tested to be positive and I've been around them within the 615 rule, then there is no testing out of quarantine. It doesn't matter. You need to stay in that quarantine for that full 14 days. Now, I preface that by saying, if you then become symptomatic, we're talking about quarantining for 14 days to see if you become symptomatic, because you can be that illness can basically not kick in for between 2 days and 14 days is the incubation period for that illness. So we've got to make sure that we stay away from other people for 14 days. If you become symptomatic in that window, and generally that exposure is going to happen on average between 5 and 7 days, we tell people if you become symptomatic, you probably should wait at least 3 days after that before you get tested, so that you don't test a negative, a false positive. And so just when you get your first sign of sniffles and maybe you are getting tired, or maybe you lose your taste and smell, generally what we're finding is that happens later on in the illness, or you spike a fever, you really should wait about 72 hours, 3 to 5 days before you go get tested to determine whether or not you want to make sure you're getting an accurate test. So with that said, if you are then positive as part of that quarantine period, then you look at when you became symptomatic as to when your 10-day isolation period now starts. And so technically, if your symptoms started on day 2 of your quarantine period, then you go get tested because your symptoms have kicked in and you test positive. You could knock 2 days off of your total quarantine because you're actually, once you're positive, your window of isolation, I should say, is actually a smaller window because you are, you're no longer, your contagious period is a 10-day window. So I know I'm sorry, it's kind of convoluted and it's difficult to navigate through this, but we've lived it for 9 months now. So it's easy in my head to try to regurgitate that, but we do have some tools that businesses can use that can otherwise help them navigate through it.
So if a quarantined employee tests negative, they should still wait to return to work until the 14 days is up.
That is correct. If they've been exposed to a known positive case, then that employee cannot return to work until that 14 days is up. If they don't become symptomatic, no symptoms have kicked in, even if they're an asymptomatic person, so you don't have any symptoms, but you've been exposed to a known positive case, then you got to make sure that 14-day window is accounted for. And after that 14-day window, if that person was asymptomatic during that time period, then they should no longer be contagious, even if they're asymptomatic within that 14-day window. So unfortunately, employees have to be out for 14 days.
Okay, so you're saying that all employers should adopt the policy that if they have an employee who has had close contact with a positive person, they should immediately begin a 14-day quarantine.
Correct.
And so here's, a curveball of a situation that I'm aware of. Have an employee who has had close contact. They start quarantining. Their employer requests that they be tested. They don't have any symptoms. They test positive. They still have no symptoms. How much longer should they be out then for 10 days past the date of their test?
Correct. And
should anybody else test?
Other people should be sent home and quarantined if they fall within that 6 foot rule for 15 minutes, if they're not masked. Now, I need to preface this because, again, we still, some of your businesses or places of operation may be considered what we call critical infrastructure workers, okay? And there's some additional caveats that come along with this in the sense that if there are critical infrastructure workers, that includes federal, state, local law enforcement, hazardous materials providers, 911 call centers, janitorial and custodial staff, food and agricultural workers, critical manufacturing, information technology, transportation. Again, there's a group that the government focused on that said may potentially continue to work if strict precautions are after exposure, but will need to contact their employer to explore options. I would say if that is your type of business and you may have potential exposures, that your places of business should contact us to talk through what those controls may need to be. So we want to make sure that we're helping really navigate through how that process should work. But yes, if a person is asymptomatic, they happen to be tested, and we hear these stories all the time. I didn't have a clue that I was positive and they happen to be tested for whatever reason that might be, then yeah, that person needs to go home and isolate for that 10-day period. And
Okay.
anyone who is exposed to that employee, if they can be identified, should be sent home to quarantine for 14 days.
Okay. Before we bring Kristle into this conversation, Brian, would you mind just one more time reiterating, we've had a request, what close contact means?
Yeah, close contact. Now, I should also preface this: in the state of Iowa, we're not completely in alignment with what the CDC is saying. A close contact is being around a positive case within 6 feet for 15 minutes. And that 15 minutes in Iowa is determined 15 consecutive minutes, okay? So we recognize that, not we, CDC recognizes that that 15 minutes is actually, it's a cumulative 15 minutes over the course of a day. So if you're in the workplace and you're working around a positive person, it's cumulative throughout the day for that 15 minutes. So that's within 6 feet. Now, as some may have seen this document, this is a document that was put out by the department as schools continued to try to wrestle with this idea of having to shut down full classrooms, even though kids are wearing masks in those classrooms, that if I'm sitting next to another student and we're both wearing masks and one is determined to be positive, those masks didn't afford any kind of allowances to not be quarantined. So in other words, if both kids were wearing masks, they sat within 6 feet of one another, then they would any kids who were sitting in that little group would all have to be sent home and quarantined. Well, the state of Iowa came out and they had done a little bit of research. I say a little bit, it's, nothing right now is studied in great depth. But they basically said in situations where you have a business, an educational setting, or a childcare setting, if people are masked and one person is positive, they're wearing a mask, and the other person is negative and they're wearing a mask, they've been within that 6 feet area for 15 minutes, that they do not need to send home or isolate the employee who is not positive. Of course, the known positive case needs to be removed from the workspace. So that has always been the point that we've been trying to make, is that if this is functional within a classroom or it's functional within a business, then why not make mask mandates community-wide? And I do support that for that very reason. And so obviously now the governor has made comments and has come out last night with new information. And I know she's talking today at 11 o'clock, probably with some clarifications. But so for your businesses, mandating masks for people coming in, I think provides pretty significant protections for your staff and for your patrons who are coming in. If there is a positive case, and even an asymptomatic positive case, if everyone is wearing a mask and you learn now that you have an asymptomatic or even a symptomatic case, you don't have to send all of your staff home that might be working in, let's say, a kitchen area. So masks are incredibly important. Now, I think there's something else important to share here as well, and that is masks need to be maintained clean. So as masks now become soiled, let's say you're working in an area with more where it might be dirtier or it's warmer and you might get sweaty and hot. Those masks need to be removed and changed, maybe throughout a work shift. That's going to be very important. That's another question that we posed within school settings as school sports happen. And that is, as those masks become soiled during a practice, do those still provide adequate protections? And I would say that they don't. But back to your point, Robin, that is, this tool provides very clear instruction in Iowa for those who are wearing masks, who are around a known positive case, would not need to go home and quarantine if everyone is wearing a mask appropriately. And that doesn't mean wearing the mask below the nose. Okay, that means wearing the mask fully over the nose, over the mouth, and not like doing it halfway. We're talking for the full shift around other people, masks need to be appropriately worn. If they're not, then those isolate or those quarantine orders need to be implemented. So hopefully I made that clear. If not, I can certainly try it again.
Okay. So before we move on to Kristle, are there any questions? I'm just looking in the chat. We have, when does the quarantine start? The day of the exposure? What if someone has a test and only notifies the employer of the positive test? When does the quarantine start for the employees who are not positive? The day of the exposure or the start of the positive test? I think we just need to review that one more time.
Yeah, so it all depends on either when the person was tested for and found to be positive, or when the person first became symptomatic. Because when a person first becomes symptomatic, they're actually contagious 48 hours prior. So we go back 2 days before that to determine exposures. So if you had an employee who was working today, but was maybe started to be contagious yesterday or tested positive today, then we have to go back 48 hours prior to and see, okay, did that employee work around, certain employees that now need to be quarantined because they were exposed to that known case. So again, that's a 2-day window. If an employee goes and gets tested today, finds that they're positive, then we got to go back 2 days prior to when they first became symptomatic. Or if they were asymptomatic, then we go with the day that they're tested, and then we go back 48 hours prior to that. So I get it. It's really confusing and it's complicated. And this is, again, what we do all day long, is try to explain this so people understand who needs to be quarantined and when. So again, we're here anytime there's questions. We're happy to try to help employers navigate through this. I do see, if a person has tested positive and recovered, do they need the vaccine? Right now, what they're saying is, if a person tests positive and recovered, they met their 10-day quarantine or their isolation period, they have immunity built up for at least 90 days. So if that employee who has tested positive, recovered, and come back to work has been around another known positive case, they do not need to be tested, number one, and because they're going to be positive. They'll have dead antibodies in their system, so they'll be positive, but they do not need to isolate or quarantine because they're within that 90-day window. So tracking when that person comes out of isolation is important. Do they need the vaccine? Absolutely. Again, there's so much that we don't know yet about these vaccines and the effectiveness. Most likely, I would anticipate that we're going to need to do COVID vaccine on an annual basis because of similar changing nature of the illness. Is going to be similar to the flu and needing a flu vaccine every year. So right now I'm going to say absolutely they're going to need a plan to get the vaccine once it becomes more available.
Okay, thank you so much. So when you have questions, it's nice to know that CG Public Health has a lot of resources on their website, and you can also call. I'd like to bring Kristle into the conversation now from IowaWorks to help us understand what are the current rules surrounding employee leave due to COVID-19. What's required of the employer? What's required of the employee? What are the other things that we need to know?
So one of the main things right now is the Families First Coronavirus Response Act. As of right now, it does end at the end of December. So that is the requirement to pay employees up to 80 hours. Now this is going to be your full-time employees. So full-time employees that have been with you for 30 days. Your part-time employees are going to be a little bit different. It's going to be based on the hours that are worked per week as an average. But if it is a full-time employee, you are required to pay them 100% for if they are experiencing COVID symptoms, if they've tested positive due to COVID, or if it's an issue where they're being told to quarantine due to exposure for a positive scenario like Brian was just speaking of. But when it comes to the childcare issues, as opposed to the schools closing down, whether their children are 100% online, daycare closures, things like that, you would be required to do the 2/3 for their pay up to 80 hours. This again ends at the end of December though. So whatever comes down the pipe from legislation is always subject to change. We're constantly getting updates and different notifications, but as of right now, that is what we have been told by the United States Department of Labor. Again, always subject to change. As we continue, you know, the governor has been amazing at doing press conferences and trying to keep us up to date. We're very fortunate in North Iowa. Our public health department has been amazing at being very open and communicating with us. So we're very blessed to have them as well. But it's always important to just stay up to date on the changes, whether it's contacting Iowa Workforce Development or contacting the public health, and just being aware of what is transpiring, because as this continues to evolve, things are going to continue to change. And a lot of times I'll do presentations, and by the time I'm done, there's already new updates coming. So it's just a matter of kind of staying up to date on everything. And it's a lot to kind of weed through as well too. So we do understand that. And that's where, you know, any business or community partner, anybody's always welcome to reach out to me, or the chamber would always give you my contact information as well too. But when it comes to their responsibilities, the main thing is seeking medical attention. So the main thing for the employer is to, you know, verify that there is some sort of medical documentation, whether they did the virtual visit with the doctor or if they went in and physically seen a provider. For the employee, the other thing is going to be making sure that you're taking care of yourself. Obviously, make sure you're wearing masks. Do the best for social distancing, you know, limit yourself and your exposure, but just being aware of what this is really doing to us and how it's changed our environments and our workplaces, our social settings, and everything along that nature. You know, as much as we don't like it, everything that we do can impact somebody else. So just being aware of how widespread of an issue this is becoming and what we can do personally to help our communities.
And Kristle, could you just reiterate, because a lot of times for employers, federal regulations might only apply to employers if they are over some threshold of employees, if they have more than 10, if they have more than 25, if they have more than 500. But could you reiterate that this is different because it really impacts everyone?
It does. And the employer size is going to be a big thing. Those that are 50 or less employees, they do have some sort of wiggle room within that. But the one catch-22 with that for employers to remember is your part-time employees add up. So just because you might have 39 employees and 28 of them are considered part-time, you know, or 39 full-time employees, but you have an additional 28 part-time, those part-time employees add up to equal a full-time employee. So just be aware of that as well. One of the best scenarios for employers, if you're not sure, reach out to your legal counsel, reach out to your accountants. They know the laws when it comes to employment size and things along that nature. Really lean on them for that support. When it comes to Iowa Workforce Development, I personally am not a lawyer, so I cannot give out any legal advice as far as that. My recommendation is always to talk to your accountant and talk to your legal representative, because they know a lot better when it comes to the employment laws and employee sizes on what to do and how you can navigate through that system. But the main thing is anybody that has 500 or less employees is the main target for the Family First Coronavirus Response Act.
Okay, thank you. We had a couple of questions come in for Brian. Is there a difference for the quarantine time if someone only wears a shield? And maybe if you could just clarify what is the best protection? Mask, shield, mask plus shield, to give us some guidance there.
Yeah, I think that's a good question because I do see at times I see people just wearing the shield, and I believe you know, either they can't wear the mask, so that's at least some kind of protection. But if you're only wearing a shield and not wearing a mask, and you're around a known positive case, that you're still going to have to isolate. You're going to have to go quarantine. That all that's doing is protecting the eyes per se. But it's not protecting the respiratory side of it. So the mask is necessary. Now, a mask and a shield, that's just going to provide additional protections. If we go out and we're providing care in the general public for some of our nursing services, our teams are wearing masks as well as the shields. Again, that's another level of protection, but at minimum, people got to be wearing the face mask. And that's a 2-layer cloth mask. Now, gaiters seems to be a topic of discussion, and whether or not these 1-layer gaiters provide protection. They do not. They need to be either doubled up, or people shouldn't be wearing those. So if people are presenting in your places of business with a simple gaiter, and you can tell, I mean, they're just very thin, and they're usually pretty tight on the person's face, but you can tell they're just not, they're not the same level of thickness. I would ask people to put on either a different mask, or ask them to provide them with one, or ask them to go get a different mask. The one other thing I did want to mention to the group here is that one of the things that we're hearing a lot from people is that employers are asking their staff before they return to work to go and seek basically a note from their medical provider. And the problem that we are in right now is the numbers are so high, and whether it's our primary care providers or whether it's our hospitals and our clinics, but that additional step of trying to get like a note that this employee can return to work is just adding additional workloads to an already taxed medical system. And so we're asking for employers to not ask for that letter or note of that employee to return. Again, the guidelines are there. If a person's been out for at least 10 days, their symptoms are improving, then allowing that employee to return to work. It's really, we're asking for businesses not to ask those employees to go get a doctor's note, or even a negative test for that matter, because oftentimes if a person's been found positive, then when they go back in and get another test, they're going to be positive, because again, they have that antibody in their system. And just because they have that antibody does not mean that they're contagious any longer. The contagious window is that 10-day window generally, so long as those guidelines are followed. So I think that's really important. And that is a plea going out to our businesses at this time. I'm not saying not in the future that we can, that we could go back to that point, but right now where we're at, we need businesses to just, leave that request aside. And allow those employees to come back. Now, that 14-day quarantine window, I want to really, really stress. I keep looking around here for my cheat sheets, but I've got one here. Here it is. So this is a tool that we've had out there where we talk about this person here is your positive case. So once that's a positive case, then you've got a line drawn in the sand here where you're either going to be quarantined because you don't have symptoms, or if you have symptoms and you get tested, then you can shorten your window down to 10 days. This is a really good tool. I mean, again, I have this sitting on my desk all the time because I reference it for people so they understand. We want to make this as easy as possible. If there's additional tools that we can send out through you, Robin, or through Stacy over in Clear Lake, so that you can share that amongst your members, we're happy to do that to try to, again, make this process as easy as possible on members.
Well, I can tell you, we will put those 2 diagrams that you've referenced today in our December newsletter, as well as provide links to them on our COVID response pages and on our weekly emails that go out to all of our members. We had a question about childcare. With the new mandate, children in childcare settings, I believe the governor said over the age of 2 need masks. Can you speak to that a little bit?
Yeah, this is tricky. I don't know if the governor provided any, maybe some caught her comments today. I'll have to go back and watch her announcements. She tries to get some additional explanations out there. I'm guessing that's what she did today. All I can say is what's in the proclamation, that, yeah, she's asking for anyone who is over the age of 2 to be wearing face masks indoors. And so that's as much as I can comment about that. What I have found out from talking with some of the schools, we're in close contact with the child care centers. We talked with them today. In fact, talked with them yesterday. If you know a child care worker, please thank them. They have been at the front line since day one. They're an amazing group. In fact, we met with them on a Sunday. The governor announced the first case on a Saturday night, and we met with the child care centers on Sunday saying, we got to have you guys. And we have been meeting with them ever since. So again, I'm giving them huge kudos. I also want to give a huge shout out to our school nurses too. So if anybody knows any of those school nurses, they're in the trenches trying to deal with this stuff. And again, I could go on and on. There's so many people who deserve some really huge pats on the back, but you know, a lot of these kids in these preschools are wearing masks better than the adults are. So they're pretty resilient. They've really taken hold of it. And so I'm going to say anybody over the age of 2 should be wearing masks, which this proclamation, I feel, really should help businesses now to say, listen, come on, this is now a statewide thing. The governor's gotten behind this, and we need to make sure that people coming into our businesses are wearing masks. And not only that, our employees should also be wearing masks, again, for those protections and protecting our loved ones, our family members, so on and so forth. So I hope that's a welcome change. It's why I've been advocating for a mask mandate for quite some time, simply because it just makes the message more unified across the state that we need to all be doing that sort of thing.
So we're coming up to a holiday week, and I know from my perspective, I see what employers are doing every day to keep their employees and their customers safe. Can you preach to us a little bit, Brian, about how important it is to exercise behaviors when you're not at work, when you're not at school, to keep everybody safe?
Yeah, I'm glad you brought up the holiday, because I mentioned earlier, I mean, we are looking at the flu season. We are looking at, it's RSV season as well. I mean, so the hospital's recognizing all these seasonal illnesses that are going to impact them as well. But we were just talking about this morning. We have Thanksgiving, of course, so we're emphasizing and talking a lot about having small, immediate family gatherings rather than the large family gatherings. Jeremy Otto is listening. He's our public information officer. He's done fantastic in trying to get our messages out, but really talk to your employees about the need to stay home, the need to just have a quiet meal this year with your immediate family. Don't pull your large families together. I know it's really hard to say that, and it's hard to do that, but I reached out to one of my good friends who worked for Principal in Des Moines and said, it'd be great if Principal, as big as they are, could get a message out, corporate wide to have the small group. And I would say the same thing holds true with the chamber members, is to share that message about the importance of taking care of yourselves and having small groups rather than large groups, especially being around those people who might be over 65. And people who might be immunocompromised as well. The other thing we were talking about this morning is what happens the day after Thanksgiving. And I get, this is a big deal, right? Especially talking to your members. I mean, Black Friday is always a huge shopping day. And I know that helps pay the bills in some cases for the better part of the year. I'm hoping that strategies and ways that we can otherwise follow along with the governor's guidelines are being considered for how you all can still keep, economic health moving through this process. We talk about public health equals, economic health, and vice versa. Economic health means public health. And so how we navigate through that as businesses and as public health agencies is going to be something that we'll have to try to navigate that. And honestly, you're going to have to deal with that individually on how that's going to look. But certainly, again, these mask mandates, we hope will be effective, stressing that people maybe use hand sanitizer when they're coming in, leave the masks on, following all these general guidelines. And Robin, I want to point out, you sent out a really nice tool that I'm sure you will probably share from Iowa Workforce Development and the Iowa Economic Development, and then Iowa Department of Public Health. I was reading through a lot of those question answers that you sent, And it's a great resource. In fact, we've got it here now, and it answers a lot of these questions that I think are a little bit muddy, that will actually let your members put their hands on a tool that will walk them through what's the 615 rule, what is isolation versus quarantine, and how do I sanitize and clean my area, my place of business? What should I do if I had a possible exposure with an employee? How should I otherwise provide some protections for that employee's name? And how should I share that information with my employees to let them know that there maybe has been an exposure? Anyway, I just didn't want to forget about that. It was a really great resource, and I hope I didn't steal some of your thunder with this one, but it really does a nice job of providing some of that guidance as well.
And we will continue to be pushing that out. We also have a link to that on our website. A couple of other things, as we talk about family and Black Friday shopping, immediate family means the people that you live with, not the people that you are closest to and love the most. So make sure that you're making that distinction. And also something that I've noticed in, a lot of people's tradition on Black Friday is to get a bunch of people together and go shopping. And I think we need to, there are so many businesses that will deliver or meet you at the door. And if you do have to go to a store, go by yourself.
And I would emphasize, if there are some of those additional supports that the chambers would like to get out, I mean, I think working through the Joint Information Center to, and I know Colleen's on too, we can help put that messaging out, buy local as much as you possibly can, and work with those businesses to, work through some delivery, use their websites, pick up the phone and call them, whatever we can do to help in that support and still work through some of these protections. So we're happy to help as well.
Brian, can you see the questions that have come? They're wondering about if you're working, like right now, I'm in my office. Colleen is way down the hall in her office. Neither of us are wearing masks. Should we be?
So you notice I'm in my office. I have the door shut. I think as long as you're sitting in a space, and we generally say the county's policy is as long as you're sitting at your workstation, you're not moving around, you're more than 6 feet away from someone else, that you're okay to remove your face mask. Now, when somebody walks in, if Jeremy comes down the hall to see me, I would, of course, put on that face mask as he comes into my office. So I think that's appropriate, so that at least there's some reprieve. Now, I think in the school settings, kids are wearing those masks pretty much all day long, except when they're eating, and then they try to find a location to sit apart. So if you have a break room or something like that, be aware that you can't take the face mask down and then have a meal sitting right next to someone. You still need to make sure that you're keeping your distance. So I am looking at some of these messages or questions.
Yeah, and should we do special cleaning in areas where people are taking off their masks?
Yeah, I mean,
like a break room?
Yeah, I would say absolutely. And again, that reference that you sent out talks about proper cleaning in the workplace. So I won't hit on all of those points, but yes, regular cleaning and sanitizing in those workspaces. Each employee, when they're done eating their food if it's a shared space, should be wiping those areas down, certainly the table, but maybe also the chairs. So follow those guidelines for sure. Those are very important. There's a question here about working outside in the winter, who might have to wear a thicker, like double layer face mask, almost like a pull-up. Those would certainly be appropriate, again, if they're double layered for providing protections. I watched what happened this year with outside events and activities, especially with schools. And to be honest, I thought I was wrong. I believe that outside activities are significantly more safe than being indoors, which again, we're into the winter months now, and so we're all having to be inside more. One of the questions is, why are we seeing an increase in the numbers? And I firmly believe it's because we're inside a lot more. Our houses are closed up, the furnaces are on, and It just allows for that exchange of illness like it normally does seasonally. So yeah, I think being indoors is certainly more of a danger than being outdoors.
Okay.
Let's see, can Brian further clarify the new restrictions for masks required indoors? If staff are seated in offices or cubicles that are 6 foot apart, is it expected they wear their mask continuously? And I think we just talked about that. Again, I want to make sure that 6 feet is maintained. Again, I think as long as the person's not symptomatic, they're not feeling ill, or they don't have, I would even say, these are the questions we're dealing with the schools and the daycares as well. I mean, something as simple as, I just have seasonal allergies, or I just have a slight runny nose, I just have a mild cold. You cannot assume that that's just a cold. Most likely you are probably COVID positive and need to go get tested. It is literally that mild. It can start that mild and become, of course, much more severe. But again, watching the workspace and letting people know that if they are mildly symptomatic like that, they really need to go home and go get tested. I think I've gotten all the questions, but I'm certainly open to.
I think so. Kristle, is there anything you'd like to add to wrap up for us?
I know that there was the question, is there still funds available? So underneath the CARES Act, yes, there is still funds available for some of those programs with the 13-week federal extension for unemployment, as well as for the PUA. But again, that all ends as of December 26th. So I know employer accounts are being charged again when it comes to unemployment. So the main thing is if it's COVID related, and they're considered underneath self-quarantine or things like that, they should not be underneath normal unemployment rules and guidelines. They should be underneath the CARES Act for PUA. But again, if employers have any questions, please feel free to reach out to me as well. All chambers and Brian, I also have email distribution lists for over 900 employers. I'm more than welcome to share out to anybody. I cover 7 counties. So anything that we can do to help spread the communication, I'm always here as a resource as well too, and more than willing to send out emails as well to my list. So.
Yeah, that perks up our ears. I appreciate that, Kristle, and all that you do. I mean, I get the trying to navigate through all of the employment issues. We've certainly leaned on your office as well. So thank you so much for your help. And I know Jeremy's ears probably perked up as well, knowing that a lot of times we're just trying to figure out how we get communication out on a very regular basis, trying to continue to keep people updated, communicated to, and then asking them just to help follow our guidelines. And employers are essential here. So we appreciate that.
Yep.
Okay. Brian, any closing comments on your part, please?
Yeah, so I'll just again echo my sentiments, the thank yous to the businesses, to the chambers for such strong partners. I don't know if Chad Schreck is on this call, but Chad has really been our conduit for trying to reach out to businesses as well. So we have these partners as we meet regularly. I want to really stress to the businesses that we've been working tirelessly on the front lines from literally early February, knowing that this was going to be coming. We've been working really, really well as a unit, as a community. And so if there are things that we can continue to share with you or get out to you, I welcome this opportunity monthly if you want, or more if you need it. I really feel this is a great way that we can get information out to a broad group. And so that's good use of my time. And so I would welcome the opportunity to visit more if you would like to have me, or anyone else from our department for that matter. So I appreciate it, Robin, Colleen, to Stacy, to all of you who continue to do what you do. So thank you very much.
Okay, well, thank you all for joining us. If you have additional questions, we are going to try to get back to you on those things. And please consult the resources that we're providing to you. and stay safe and be well.